We are here today to mainly talk about an important topic that's on everyone's mind these days, and that is the issue of school reopening and what's going on with our school children here in North Carolina. And to get things started, we're going to hear from Kaylan Szafranski, the NC Child Health Program Director, who's going to talk a little bit about the data and the science that's behind this issue and what we're hearing from some of these scientific results. And then we're going to hear from a special guest. We're really glad to have him today, Mr. Keith Sutton, who is the chair of the Wake County School Board, which, if I'm not mistaken, is the largest school system in the state of North Carolina and probably in the top 20, 25 in the country. Mr. Sutton is an educator, an advocate, an entrepreneur. He's done extensive work around educational issues here in our state, was a candidate for the State Department of Public Instruction, has been a member of the Wake County School Board for over a decade, really knows his stuff and does a wonderful job representing children and the people of Wake County. And so we're going to be very interested in hearing from him and how Wake County is grappling with this issue. And then last but not least, we're going to have a legislative update from our lobbyist extraordinaire, Ashley Perkinson. There is a lot that has started moving and happening at the state legislature this past week, and she's going to have some updates for us on that front as well. So unless, Fawn, there's anything else, then we are going to get started with Kaylan, and take it away, Kaylan.
Thanks so much, Adam, and good morning, everyone. I'm so happy to be here with all of y'all on a rainy Friday morning here, but Friday nonetheless. So I hope, everybody has good plans for the weekend ahead, but I am happy to be here to talk a little bit about some of the resources that have come out very recently from the CDC around trying to reopen schools. So as I'm sure plenty of you know, the CDC recently authored a report on reopening schools using data from kindergarten to 12th grade schools that reopened for in-person instruction this past fall. So the report showed that there was very little evidence that schools contributed meaningfully to the spread of COVID-19. And among the school systems that were cited in the report, 11 were North Carolina districts. So in those 11 districts, during the 9-week period this past fall, researchers found that 32 infections were acquired in school as compared to 773 cases of students and staff infections that were obtained outside of school. And it's worth noting that of those 32 infections that were in school transmissions, they did not involve students infecting teachers or staff. The report, of course, also emphasizes the need for continuing protective measures, right? Like continuing to wear masks and social distancing, making sure students have access to appropriate things like antibacterial hand soap so that they can continue to wash their hands. And then they do note that there should be strict limitations on what the CDC has been calling high-risk activities, including indoor gym classes and sports. Of course, and we'll hear about this a little bit more, but one of the compounding issues that has become increasingly concerning, especially to me on the NC Child side, is the impact of closure on students' social, emotional, and mental health. So not only due to the lack of things like peer relationships and developmentally appropriate experiences, but because an incredible number of our students rely on schools to access vital behavioral and mental health therapies and other school-based health services. So they're really relying on schools to get access to these services. And recent data from NCDPI shows that 11 to 17-year-old students who took mental health screens since March of 2020. So of that group that got screened, 83% of those students screened positive or at risk for anxiety, And 91% of those students screen positive or at risk for depression. So this data really shows that young people are struggling a lot, and mostly with their mental health. And it's worth noting that the proportion of students that were screened for either positive or at risk for anxiety or depression was respectively approximately 9% higher than the averages in 2019. So we're actually seeing the data track that students are increasingly anxious, experiencing depression on higher rates. So this is a real major cause for concern, right? Because not only is COVID-19 taxing, I think all of us, we can agree, but we know that the developing mind of children through young adulthood, it's really critical that they have access to the right services and supports that they need to help not only ameliorate and address mental and social emotional health concerns and treat them, but also be a part of the prevention piece as well. It's also worth noting that school social workers in the state have been reporting that mental health is the second biggest challenge of the school year that have come to them since learning has been predominantly remote. And so, schools are, as I mentioned, a pivotal access point for a lot of services, but really they serve as the gateway to early intervention for social, emotional, and mental health wellness. They can help identify student needs and provide, when necessary and appropriate, referrals and treatment. So like I said, students can get those supports and services that they need to be healthy and ready to learn. And of course, schools are also critical for so many students to be able to receive physical health services as well, right? So not just mental health, but they really play a huge role in physical health, including the management of chronic health issues for so many students. And so with all of that said, it's important to know that the CDC report, and I can put a link to that in the chat when I'm done, this guidance is exactly what DHHS is using, as well as the governor and school districts. They're really using this to consider how to appropriately prepare to reopen safely and effectively. And so I think this conversation is extremely important, that we're using science in our state to back up the decisions that are being made so that students and teachers can get what they need in safe and effective ways. So with that, I will pass it back over to you, Adam.
Thanks so much, Kaylan, for setting the table there, some around the scientific evidence that's out there and available. Look, we know this is a complex issue and there's lots of passionate feelings about it. We're trying to present to you all, again, a data-based point of view around this, and the perspectives of someone like Mr. Sutton, who is charged with administering the school system and how things are moving forward. So again, a reminder, as Mr. Sutton speaks, if you have any questions and want to put those in the chat box for either him or Kaylan, we will certainly try to get to those after. And without any further ado, thanks again, Mr. Sutton. I'll turn it over to you.
Thank you, Adam. Thank you all for having me. Thanks, Michelle, for the invitation. It's great to see you this morning. Much appreciated. And just glad to be here with you all to be able to share for a few minutes. I think Kayla touched on really a lot of really important points and great points, particularly around the social emotional piece and needs, for students. So thank you, Kaylan, for your information. You were spot on with that. I would just say for us as a board, and now sort of focus on, what has been part of our decision-making process and what has been a challenge or the struggle for us, if you will. And quite honestly, as you know, it's not been an easy road for. I certainly think that leadership matters, and I'm thankful that a board of strong leaders and a superintendent, and Kathy Moore, who was a strong leader as well. But we have struggled with, quite honestly, trying to balance the health and safety risk of students and teachers and our employees with much of what Kaylan talked about, the social emotional or risk benefit of students not being in school. And that's what, and we're seeing all the things that she touched on, the increased anxiety levels in children, depression, increased rates of obesity, even increased rates of suicide. And that we're hearing that pediatricians, the Academy of Pediatrics. So again, as Kaylan talked about the science, all the science and the data, backs up what we have been hearing. So that's been a challenge for us, is how we move students and teachers and faculty into the building and do it safely. And that has been something that we have wanted to do here in Wake County for quite some time now. And so it's been an interesting challenge because we sort of keep moving the date and folks, so when you keep moving the goalpost, when are you going to make a decision? And you'll see, other districts have already made the decision to cancel the remainder of the or to not come back until sometime in March. And what we have really tried to keep the door open. So if it seems like, we're kicking the can down the road, we can't make a decision, we don't want to make a decision, I've told some folks that's probably because that's true. Because what we have tried to do is leave that door open to get students back into the building at some point this school year. And so it is not for a lack of leadership, but I think really more so a desire to see students return to face-to-face instruction. There is no way to replicate or replace the value and the benefit of face-to-face instruction. And again, as Kaylan touched on, schools are a place where students are able to access services. And that's difficult to do in a virtual environment. That's difficult to do online, just as it is, difficult to engage students. We're seeing what we don't hear a whole lot about from some of the science and the data, and some of that's more, I guess, in terms of internal, but the increased rates of absenteeism that we're seeing. And that has a huge or negative impact on students. And we're seeing that in their academics, and of course, their grades reflect that. And so we're seeing about 25% more of our students failing at least one class. That also is concerning. We are seeing the increased rates of absenteeism, as you can imagine, among students of color. The rates of absenteeism are higher among Black students and Hispanic students. And so while we have not seen the grades that reflect that just yet, I can pretty much assure you, with 99% certainty, you're going to see that reflected in our academics as well. And we will see, I believe, increased failure rates, again, among our students of color, which is just going to continue to exacerbate the achievement gap. And so, I think the important piece to begin to really focus on now as we move back into the buildings and back to face-to-face instruction is recovery, and how we begin to address that. I think starting with how we measure the impact of this 10-month or 10-month plus loss, and I hear different conversations, and people don't want to talk about the learning loss, but I think we're just sweeping under the rug, if we do that. We voted this week, as you well know, to return students to school, and quite frankly, personally, I feel like it was time to do so. We've got middle school students and high school students who have not seen the inside of a building since March 13th. And we have had teachers, principals, administration, personnel work extremely hard over the last months to make sure that our buildings are safe for students and teachers. Everything from making sure that desks and seats in the lunchroom, cafeteria are socially distant, that we've got proper entrance and exit pathways to the building, that students are walking different sides of the hallway, that water fountains are taken care of. Every movement in the building, from classroom to bathrooms to health and PE, what students can and can't play with, the high touch, all of those things have been worked on. Carpool, bus exits, and that sort of thing. A lot of work has gone into making our buildings safe. And, I have really preached over the last few weeks that, my students, for example, I've got a high school senior and a senior in college. My high school senior is was just a few points away from making A honor roll. She made AB honor roll last spring, almost A honor roll this fall semester. My senior in college made the dean's list for the first time in her career. And so my students are doing well, but there's so many students who are not faring well, who have struggled in this virtual environment. And it is those students that I'm most concerned about. And that is the ones who can least afford to be without the face-to-face instruction, the human touch of a teacher, the access to social workers and guidance counselors, the access to hot meals. And I could go on and on, again, as Kaylan touched on, about the benefits of, that students receive being in the school building. And for 10 plus months, I'm sorry, that's just a long time. And if we feel like we can do it safely, then I think we owe it to those students to give it a shot, to try to get back in the building. And I've said too, hey, look, if we can't do it, if students are hugging and high-fiving and slapping each other and kissing and hugging and doing everything else, then I'll be the first to say, hey, let's get them out of the building, abort mission, let's try something else. This isn't working. But I think we owe it to those students to try. And I think that we can do it. And I think that we can do it safely and successfully. The last piece that I will touch on, obviously, which I think now is at the forefront of most people's mind, is the vaccinations. And that's something that we, as you well know, don't have a lot of control over. We have advocated behind the scenes with our local and state leaders to prioritize teachers, number one, but also to get more vaccinations into Wake County. But that's also, across the state as well. I mean, I think a lot of the county should be allocated vaccines based on, the population. And in here in Wake County, as you well know, we've got a lot of healthcare providers as well. And so it has pushed teachers down on the list. And, we understand that. We don't think that teachers should necessarily leapfrog, other important groups. But I think but our teachers are on the front lines, making sure that our students are receiving an education, receiving services, and that we do think that they ought to be prioritized in some fashion. And we will continue to advocate for prioritizing teachers to get access to vaccines. So those are just a few thoughts, but I'm happy to delve into any other areas and take any questions at this time, Adam, if it's appropriate.
Thanks, Mr. Sutton. Really appreciate that. You certainly touched on a lot of the key issues there that I know is on everyone's mind. And Fawn, do we have any questions that have emerged?
Yeah, I think the first one's actually from Michelle. Just Mr. Sutton, if you could touch on what are the resources that are most needed for schools to reopen safely? So is that extra staff, health or mental health staff, and sort of, we know schools are under-resourced in terms of school nurses and social workers. And so what do you all need most to come back safely?
Yeah, thanks for that question, Michelle. I think that in terms of resources, probably staff is the biggest piece right now. A few things that we have, looked at in our decision-making process, or tree, if you will. One, obviously, has been any executive orders coming from the governor and DHHS. That weighs heavily to our decision-making. Two, we look at the local and state health trends and data trends to see where they are trending. And obviously, as we made our decision this week, they are moving in the right direction. Still somewhat high. I think last couple of days, I've seen the positivity rate hover between 9 and 10%. And I think the governor and our Dr. Cohen would like to see that obviously more closer to 5%. So they're still concerned about the 9 or 10%, but that's way down from what we saw just a couple of weeks ago when we were seeing hospitalization rates, positivity rates, deaths at record levels, if you will. And that was when we made the decision then to push our opening back to mid-February. And then the other piece that we look at is our operational efficiency. Do we have enough staff in the buildings? Other things such as PPE and cleaning supplies and that sort of thing. And we've been ordering, as you can imagine, in very large shipments, because as Adam touched on, we're the largest district in the state, 16th largest in the country. And so just when you look at the amount of cleaning solutions or wipes or masks and that sort of thing, we've got a pretty good stockpile of those things in our warehouses now. But it has been difficult, as you can imagine, and I'm sure you've seen some of the commercials and marketing pieces around trying to get more substitutes and people to apply for substitute teaching positions, as we have teachers that are that run into or have either tested positive or come into contact with someone who has tested positive. Obviously, they have to quarantine themselves for 14 days, or quarantine or self-quarantine for 14 days, and substitutes who were willing to work at one time back in July or August are not as willing to come into the buildings now as a substitute. And so having the additional staff is particularly helpful and one of the biggest resources that we need right now.
Great. We have some more questions coming in. And so Rachel's got like a two-part question. I want to focus on the first part around students who have either learning differences or, other special healthcare needs or things like that. And just, how are school districts dealing with that challenge where some kids are going to have more anxiety about coming, even though they need and want to be in the school buildings, about coming back and getting sick and complying with protocols. That can be, it's more of a challenge for some kids than others, and kind of how are school districts thinking about working with kids who have learning differences or special health care needs?
So what many districts have done, we're no different, and that's trying to get those students in the building more frequently. And so for us, K-3 students and students with special needs, we're bringing them in on a daily basis for face-to-face instruction. And what I mean by that, of course, is some of our upper grades, middle school, high school, they're returning on a cohort basis. So we have really our entire student body across the district broken into 3 groups. One group comes in for 1 week, and then the other 2 are remote for those 2 weeks. And then each group sort of rotates in a 3-week cycle. But for our special needs students, they're coming in daily, just as our early K-3 students, because as you all well know in terms of developmental needs around literacy, and this, again, the cognitive brain development that is taking place at that point. We think it's important for our younger students to be in the building more frequently. Obviously, that involves having more of our elementary teachers in the building. Again, the addition of social workers and counselors at those earlier grades, more school nurses in the building as well. And so that's what we're doing there, is trying to make sure that there is more contact or high level of contact with those students early on.
Thanks. And we have a couple more questions coming in. I think the second part of Rachel's is more of a comment of just like really lifting up the differences between rural and urban urban suburban school districts in North Carolina in terms of resources, to do these kinds of things, which is a real challenge. And we're going to talk about the legislation that has been proposed and all those things in a minute. Last thing I think folks wanted to ask you about is higher failure and absentee rates and things kids need to get up to speed, and sort of how are you and other school districts thinking about how to try to make up for some of that learning loss and especially some of the inequities that we're seeing there.
Yeah, that's one of the, I'll be honest, I don't know the exact answer to that question, so I'll say it up front. And what's the more frustrating part about that for me is that we haven't had a chance to talk about that. I think now we should be at the point where that's the topic of the discussion, as opposed to, and I'm hoping that we can shift to that very, very quickly now that we made the decision to get back into school. But what that recovery will look like, will we be in summer school, and how that will work? Will school start early in August or perhaps July? Will summer school be an option? I think it might be difficult to make summer school mandatory for all students, but for parents who feel like that summer school could be helpful in terms of recovery, or that they weren't as engaged during this virtual environment, that summer school is an option. And if that happens, then where the resources come from, how are we going to be able to keep schools open, to pay teachers? Will there be additional money coming from either the state, and obviously I think, some of that will shift to our local government and local county commissioners to help figure that out. So obviously there's the federal CARES money that we still have available, and that might be a strategy to help with that as well. So we really don't know just yet, but I think that is certainly on the minds of everyone, including our teachers, because as you can imagine, that'll probably be almost sort of double the workload, if you will, in terms of trying to catch up or make up for and recover some of the learning loss that has occurred over the last 10 months. So I think that's going to be a huge question and challenge for all of us as districts, and that's going to be, I think, exacerbated as you touched on, in terms of the differences in availability of resources in our urban districts versus rural. As I campaigned the state, as Adam touched on a year ago, the differences are quite stark. And while we have our own challenges here in Wake County, I think we are fortunate also to live here in Wake County and have a well-resourced school district that we do.
Agreed. Thank you so much. I don't see other questions coming in the chat box, so I think we're good.
All right. Mr. Sutton, we appreciate it so much. Feel free to stay with us here for the remainder of our call, but we also understand you're really busy and have a lot going on. So we do appreciate you being with us again today.
Well, thank you. I appreciate it. And I'll certainly hang out for a while and just listen to the conversation and the thoughts. And I appreciate the work again of NC Child, and Michelle, thank you so much for your leadership.
All right, so now we are going to hear from Ashley Perkinson, the NC Child lobbyist. I feel like Ashley, we've been keeping you very busy this week, trying to stay on top of things. So take it away.
Thank you, Adam. Yes, it has been a very busy week, and thank you so much, Mr. Sutton, for that terrific overview and presentation. It's good to see you all this morning. So yes, it's been a busy week at the legislature. There are two bills that I specifically want to highlight. The first bill, Senate Bill 37, and this is the bill that we've had some discussion about this morning. So this bill, it's just a 2-page bill, but it would require school districts to provide in-person learning under Plan A, specifically for children with IEP. So really focusing on those children with special needs. So it would be the requirement for in-person learning for those children under Plan A. For all other children, it would still require the school districts to provide that in-person learning under either Plan A or Plan B. There is a provision in the bill if a school has an outbreak, a COVID outbreak, that the district could close that particular school, and there is some flexibility there. But the overall thrust of the bill is to mandate that school districts do move to in-person learning. There was a good discussion of the bill in committee. There were also presentations by parents, specifically parents of children with special needs, who talked about the struggles and concerns of their kids being in remote learning and their need of getting back to in-person learning in schools. So that was really, I think a big part of the advocacy in moving this bill forward. The bill did pass the Senate in its first the first main vote. It passed 29-16. There will be a final vote next week, but anticipate that it will pass the Senate, and then of course then move on to the House for consideration after that. So that was the main development on in-person learning this week, and that bill with the legislature. But in conjunction with the movement of that legislation at the General Assembly, there was also a press conference. Probably many of you saw it, the governor's press conference yesterday afternoon. So his press conference also highlighted the importance of getting children back to school in person. His presentation really covered a lot of those points, and the data that seems to suggest the safer levels for kids being in schools and the lower transmission rates. But that announcement did stop short of a mandate to require that school districts go back to in-person. There was a question by a reporter whether the governor would veto the legislation that the General Assembly is moving forward when it gets to his desk. He did not commit one way or another on that. So this is still, kind of a fluid situation. State Superintendent Catherine Truitt also spoke during that press conference and also reiterated, her thoughts on getting kids back into school. And also the board chair of the State Board of Education also spoke as well. So a lot of focus this week on COVID and on in-person learning for kids in school. There was another significant bill that moved forward this week. This actually got through both chambers. It's Senate Bill 36. This bill started out primarily as more of a COVID technical bill. As you remember, the first set of deadlines for the CARES federal the CARES federal legislation that the state adopted during this past short session when they implemented the federal CARES bill in allocating where some of those federal dollars go. Most of the deadlines were around December 31st. So this bill, Senate Bill 36, extends those deadlines, but also it would allocate some of the funds from the federal bill that passed Congress in December. And these are some pretty significant allocations. One allocation would be for $1.6 billion to go to K-12 schools. When you look at the bill, there's not a description or a lot of additional information on how that money will be distributed, but there was good conversation about using that money for mental health services, for getting kids into summer school. So some initial discussions about where the $1.6 billion will go, but that description is not really provided in the bill language. That bill, Senate Bill 36, would also provide $95 million for vaccine preparedness. And so, again, these are federal dollars, and based on the COVID relief bill that passed this past December, that passed Congress this past December. Those are two of the major pieces of legislation that got movement this week. There's also another bill that we wanted to highlight. And this is a bill that has received very strong sponsorship on both the House and Senate. There's the companion bills. And it's also a bill that is included in NC Child's advocacy priorities for this session. And it's the bill that would ban marriage for children under 18. So we're glad to see that bill is introduced and with some very strong sponsors on both the House and Senate side, and will likely move forward this session. So with that, those are the main updates. I'll turn it over to see if there are any questions. And I'll also put in the chat box the link to Senate Bill 37, the bill that would require in-person learning for students.
Ashley, one question from Rachel on Senate Bill 37 is, does it have a virtual option still?
Yeah, thank you for, yes, absolutely. So it would require schools to provide the in-person learning, but still include the virtual option if a child or family wanted to continue to stay in virtual learning.
Great. And I know you talked about Senate Bill 30, I think it's 36, right? That's the COVID relief bill. I think you mentioned this, but I want to lift up again the extra credit grant deadline for parents to get those checks for $335 was extended, I think, till the end of April or May of this year. But I think that's really important because we know that most parents who don't file tax returns hadn't gotten those checks. So we're glad to see that deadline extended.
That's right, absolutely.
Other questions for Ashley? Chat box, anything about this week at the legislature? I feel like things got off to a very brisk start at the legislature this session.
Well, thanks so much, Ashley. And, you know, I guess it's not within our purview, but also saw there was a deer secretions bill that was filed, but guess that's a little off topic. So thanks everyone again for joining us today. And if I can just editorialize for a second, which might scare Michelle here, but I'm not, just to say that we also understand that this school reopening issue is very complex. We want our teachers to be safe. We all wish that like all our teachers who wanted to could be vaccinated like tomorrow. We want our kids to be safe. And there's just so many different factors to take into account. That I know we certainly are trying to follow the science, maintain an open mind, learn as we go. Nobody knew we were going to be in this position. I quite frankly also think that some of this falls back to we could have perhaps been a little more prepared through a prior administration federally. And we haven't been, and we're playing catch up in some ways there too. And I think that all falls into it. But, you know, we appreciate that we're able to have this dialogue and conversation about this and other important issues. That's why we really, not only getting the legislative updates, but that's why we like to have these calls so we can cover some of these topics. And right on cue, you see Fawn has put up a slide here for some of our future conversations we're going to have over the next few weeks. So we think those will be informative. And at the federal level too, there will certainly be some movement. I guess I saw that the U.S. Senate went through the night last night, and it sounds like the House and Senate have both kind of laid some groundwork so that they can move forward some COVID relief legislation here over the next few weeks. And the question will be, how does all of that come together? So before we go, I'm wondering if there are any other announcements for the good of the whole.
Adam, I'll just say, Michelle's reminding me in the chat box that we didn't really talk about what's happening with the federal budget issue in the COVID relief bill, but you know, there has been, y'all probably know, there's been a Republican proposal that our Senator Tillis is part of to come in at a lower number on federal COVID relief, and negotiations are ongoing, but it looks like Congress is, and the Democrats in Congress are really pushing to move Biden's American Rescue Plan. And for us, I think the big piece of that to always keep in mind is the analysis on how that would really affect child poverty in the US is kind of mind-blowing. And I think we've said this before, but that American Rescue Plan, the analysis is that it would cut child poverty in half in the US. So this is no small matter and definitely something to continue watching. So we're, I mean, I think happy that our that our Republican senators are engaging in those negotiations, but also really hopeful that, that the scale of the package that will hopefully pass is actually on par with the scale of need right now. So just something to keep in mind. But anyway, yeah, upcoming Friday updates. Next week, Vicki Krause from our team is going to be talking about the 2021 Child Health Report Card. We have that coming out with the North Carolina Institute of Medicine. The following week, we're going to get you an update on what's going on with Medicaid transformation. We're really excited that an ombudsman has been named for that program. So we're going to be talking more about that, and also with one or two members of our Parent Advisory Council who are really directly impacted by that issue. And then very excited about the 26th of February, we're going to have a pair of legislators come and talk to you. Representative Donna White, who y'all may know is chair of the House Health Committee and a real champion for kids. We're excited to have her. And then brand new Representative Ricky Hurtado, who is a former NC Child board member. We're delighted that he was elected, and another strong voice for kids. So it should be great to ask both of them your questions. Really looking forward to those presentations.
Yeah, and I think the only thing I might add just to that great lineup that we have is that, these calls are for you all, our Child Advocacy Network members. And so we really would love to hear if there's specific topics that you all would like us to explore in future calls as we go through the legislative session. We would love to hear what those ideas are and are very willing to work with you and your partners to kind of highlight and lift up some of the things you're struggling with and looking at in your own communities.
Absolutely.
So everyone should email Adam, basically.
Happy to receive those emails. Okay, everyone. Thank you so much. If there's no other announcements, I hope you all have a wonderful weekend, and we will see you next Friday.
Bye. Take care, everybody.
Bye, everybody. Happy weekend.